Endometriosis tends to start when girls have their periods. It can affect people in lots of different ways, and it's not always easy to have a clear idea of exactly how. The most common symptoms of endometriosis are cyclical pain around the time of the periods, and this can cause pain when you're going for a wee, pain during or after sex. It can be severe pain that usually scores about a 7 to 9 out of 10, with 10 being the most severe pain that someone's ever felt. It can be associated with menstrual migraines, and for some women it can stop their normal daily activities, so they'll end up in bed, unable to work, unable to look after the kids. And endometriosis costs the UK economy £8.2 billion a year. That's actually the same cost as the Paris Olympics, but we spend that or lose that money from the economy every single year because women can't work if their endometriosis is really severe, and also because of treatment costs. One of the reasons that it's hard to diagnose endometriosis is it affects women who tend not to be taken as seriously when they describe pain when they go and see their GP, but also because some GPs will say, well, this is a normal period, and I think we need to learn more about what a normal period is so that we all know that if your period is associated with such severe pain you can't go to work, that is not a normal period. The other reasons why diagnosis can take a long time is that sometimes women might feel embarrassed about going to the doctors. The only people that they talk to about their periods have been their mum and their sister, and their mum and their sister might also have really painful periods, or it might get confused with polycystic ovary syndrome or irritable bowel or an appendicitis, and so there can be some misdiagnosis. But we're really hoping that by informing people about what a normal period is and what an abnormal period is, that we can change the way that people perceive endometriosis and help people get a quicker diagnosis. We've been working on a urine test for endometriosis. It works by measuring a protein that people excrete in their urine, and we're looking at the levels of this protein. If there is a normal level of protein, we know what that is. If there is an abnormal level of protein, we know what the chances are that someone has endometriosis. We've been studying this test now since I think 2023, and we've been able to collect over 400 urine samples from people with endometriosis, predominantly people who've been going to the Hay Endometriosis Clinic at Castle Hill Hospital in Hull, but also people from further afield who have asked to join in the study, and we've been really happy to have their samples join our collection. We also have samples from over 180 healthy volunteers, and they're really important, so we've got comparators. We want to look to see, does the test also pick up polycystic ovary syndrome? Is it impacted by someone having thyroid disease or diabetes? And are there any particular diseases that come hand in hand with endometriosis, and does that affect the test in any way? We would hope that the test would be used by GPs, so we think it's always a good idea to have medical advice for a woman to go into the GP and say, okay, this is the pain I'm experiencing around the time of my period, these are the symptoms that I have. The GP should do an exam, he should talk to you about your clinical information, and then recommend that you do our urine test. And hopefully then our urine test can tell you what the likelihood is that you have deep endometriosis or not, and based on that you can be referred to the right treatment pathway. In the UK at the moment, the average wait time for a diagnosis of endometriosis is 9 years and 2 months, and that's according to data from Endometriosis UK, and they have lots of helpful information, so if you want to learn more about endometriosis, it's a great place to go. The test takes us 1 day to perform, and we're able to run it on a reasonably large scale. So we hope that when it does become available to the NHS, or however it ends up being rolled out, that people would be able to do a urine test at their GPs, and their GP would be able to send it off. The test itself takes about 6 hours, and then we would then read the results and send back a letter to the doctor saying what type of endometriosis we think someone has, what the likelihood is, and then it would be up to you and the GP to talk about your symptoms, talk about your options and make a decision about the way forward. So we would be going from a 9-year wait to potentially a couple of weeks for a diagnosis, and hopefully with this test being non-invasive, quick and easy, then you can get a result much quicker, stop people being referred for a laparoscopy when they don't need one or want one, and instead they'll get their diagnosis from our test. The other important way that you can get help and support is through one of the community endometriosis support groups. We have one in Hull called the Hey Endometriosis or Hey Endo support group. You can find them on Facebook, but there are lots of different Facebook groups. I know our Facebook group accepts people wherever they live. So if you want more information, you want to meet a community of like-minded people, even if you don't have a diagnosis, it's a really good way to not feel isolated. And I think getting a little bit more feedback about how you can get support in the workplace, maybe talking to your employer about a workplace charter, getting support to make sure if you're taking a lot of time off work that your employer supports you and puts some changes in place that allow you to then work and not fall out of the workforce. All of those things are really good, and just knowing you're not alone, because you're not.